know that approximately 38,000 children and teens in the U.S. live with Crohn's disease, also known as CD. Crohn's disease is a chronic inflammatory disease of the gastrointestinal tract. Crohn's disease can uniquely affect children in some ways, including delayed growth. Here to talk about the disease, we have Dr. Sokolow and Nicole. Thank you so much for joining us to talk about this.
Thank you for having us.
And Nicole, you actually suffer with Crohn's disease. Can you tell us a little bit about that?
Yeah, I was diagnosed with Crohn's disease when I was 14 years old. And three things really kind of stick out to me about my experience so far. And that would be that the first thing, that talking to my doctors and learning how to communicate with them has definitely been a learning curve. Second of all, it's been very important for me to have my parents as a really strong support system. And the third thing would be that while this is my experience with Crohn's that I'm sharing today, it's going to present differently for everybody. So kind of going back to that first point, the symptoms of Crohn's disease can be extremely embarrassing to talk about, especially as a teenager. It can be very difficult to talk about having diarrhea. And also sometimes you don't have that language, knowing how to talk to your doctor about what you're feeling. So for me, having my parents be that strong support system was extremely helpful, because sometimes when I couldn't find the words to describe how I was feeling, they were able then to help me communicate that more effectively to my doctor. And sometimes too, especially as a teenager, the challenges that come along with having a chronic disease such as Crohn's disease can be very difficult. What kind of sticks out to me is that, being diagnosed in middle school, all of my peers, they were able to have these wonderful foods like pizza and ice cream, whereas I was having nutritional shakes because of my condition. And along with that, having a chronic condition, it's hard to talk about how sometimes you're going to feel sick for longer periods at a time, and also that you may feel fine, look fine on the outside, but feel very, very sick. And especially as a teenager or a youth, that is extremely hard to communicate to your peers.
Absolutely. And Dr. Nicole touched on some very sensitive subjects there, parents who have to deal with their children having Crohn's disease and being able to speak for them. What are some of the top tips for parents who have children with Crohn's disease that they need to know?
Well, first and foremost, it's really understanding what the signs and symptoms of pediatric Crohn's disease are. So you may think of a gastrointestinal condition as something like abdominal pain, stomach ache, for instance, or diarrhea. But for children, pediatric Crohn's disease may present differently, such as fatigue, delayed growth. You may see iron deficiency. And so the usual symptoms that you may think about for gastrointestinal inflammation may not necessarily be the apparent thing that comes out. So first, understanding what the signs and symptoms are incredibly important. Then once you've identified that your child may be having these symptoms, you may want to see your healthcare provider. So it may be your pediatrician, maybe your nurse practitioner, your family physician, and you really want to talk about what your child is experiencing. And I would encourage the child to also have that same dialogue with that primary care person. Then after that exchange, if it's felt that further testing needs to go further, or that they need to see someone more about these conditions, a specialist such as a pediatric gastroenterologist may be a very important person who will then go and ask further questions and then ultimately diagnose pediatric Crohn's disease.
And doctor, this is such an important subject that we definitely couldn't cover here in just 4 or 5 minutes. Where can we go for more information?
Sure. So again, once you have been identified, or your primary care physician has identified that there's an issue that needs to have further specialized attention, going and speaking with your specialist, making sure your child feels comfortable and ask questions to who that specialist is incredibly powerful. We know that Crohn's disease, its signs and symptoms are unique for each person, and so therefore that information coming from the specialist may be incredibly powerful to the understanding of what pediatric Crohn's disease is for your child.
Doctor, thank you so much for that information. And Nicole, thank you so much for sharing your story. Happy holidays to both of you.
Happy holidays.
Thank you, you too.
Stay right where you are. The Morning Blend will be right back.